So we're going to start with insurance in Puerto Rico. So here you have the three types of insurance, like in the States. You have Medicare, Medicaid, and the private insurance. In terms of Medicare, pretty much every facility to accept Medicare has to be certified by the Centers of Medicare Services. So if you go online to that website, you're going to see all the quality outcomes of a hospital in Puerto Rico that accept Medicare. The same thing goes with private insurance. Private insurance, you're not going to see the big names like Aetna or Cigna or even United, but you do have the equivalents of those insurance. If you have United, for example, from the States, they use here the MAFRE network. If you have a Blue Cross Blue Shield, you have a Blue right here, which is Triple S. And so they use that type of network the same. With other insurances, pretty much what you have to do is verify if you're out of network, if it has to be through reimbursement, because some hospitals do accept Cigna and United and Aetna, like for example the hospital I work in, they do accept those insurances, but you have to make sure, because if not, co-payments and deductibles could vary within the different areas. Then they also have the other specials. Veterans, you have a veterans hospital here. Workers' compensation, same thing as in the States. If you fall at work or you have an employee at your company that falls at work or something, they have to go to the workers' compensation hospital, the industrial hospital in Puerto Rico. And the same thing goes with, if you have, in car accidents. Car accidents, very different. There you have the ACA insurance. So if you have a car accident in Puerto Rico, they're going to take you directly to the trauma center, and it's covered by that. No medical insurance, not even the Triple S or the Cigna here, will cover medical car accidents. That's a different story, and I'll explain later, because that's a very peculiar thing in emergency that can happen to any of you. Hospitals. To open a hospital here in Puerto Rico, you have to have a certificate of necessity. Very few states have that. New York has that, for example. It's because of space. So it has to do with population. That's why here hospitals work on capacity, and they're very packed. Not like in the States where you see that they work on 40% capacity or 60%. Here they work on 75%, 85% capacity, because they have to have a certificate of necessity. You cannot just open a hospital to do a business because you want to. You cannot do that. You have to have a license by the Department of Health. But then you have the similarities as in the US. Joint Commission. Most of the hospitals, not all, but most of them, are accredited by the Joint Commission, which is the accredited body by the United States of America. It's not Joint Commission International or any international agency. The same thing goes with Medicare. If you go to the websites of Joint Commission and Medicare, you can see all the quality outcomes of all the hospitals here, and you can make a choice. Say, I don't like this hospital, and the same thing even with US hospitals. Some of them have bad quality outcomes. And where I worked in Massachusetts, you had both. Regulations, the same thing. All of it has to follow US standards. We're talking about FDA. No equipment, no medication can be bought if it's FDA approved. So you're not going to have experimental treatments, experimental drugs, nothing like that. This is not another country. So it's very important when you see that in those terms, medications are going to be, same types of pricing. Some of them may be less expensive, but it's because of the FDA regulations. Blood, the same thing. Blood is by the American Red Cross standards. It's not an international standard or anything. Medicare, radiation, labs, CLIA, ACR, NCR, all of them US regulatory agencies. For example, a doctor, and Dr. Mariano can tell you, he has to have a DEA number to prescribe medication. Here, you're not going to have nurse practitioners. That's not available in Puerto Rico. I'm not going to say it's illegal. I'm just saying they're not available. Only physicians can prescribe. So there's very strict regulations in terms of licensing and accreditations. And then you have the special accreditations. More and more hospitals in Puerto Rico are going to have big centers of excellence. You have oncology hospitals that have an accreditation on the Commission of Cancer, which only 5% of the hospitals in the States are cancer hospitals have that. The same thing with stroke. You have Joint Commission, Primary Stroke Center, epilepsy, burn, that are accredited by that specific accreditation on that specific field. Not all of them are. Like in the States, only some of them are, but you have to look. If you have a pre-existing condition, if you have a specific area where you think that maybe you're high risk on, then you should verify what are the areas. If you're gonna, what's the nearest stroke center? What's the nearest cardiac center? So what are the differences? Okay, so the differences here in Puerto Rico, mainly biggest language. So language barrier, when you have physicians, most of them, say 90% of them, know English because they have to take the USMLE. Most of them do residencies in the States, fellowships, and even for the local population that are Spanish speaking, they write in English because ask something staff in the hospital, what's a CT in Spanish? They have no idea. There's certain terminology that's in English, point blank. But you're going to see it with staffing, nurses. Not all of them are bilingual, technicians, RTs. Even though when you go to a nursing school in Puerto Rico, the books are in English, and the same thing with the radiology technician and the respiratory technician, but in the equipment, the instructions are in English, many of them have some difficulty communicating. So what do you have to do? You have to ask. I want a the nurse that speaks English. I want to talk to the head nurse. Translator services. All hospitals here have translator services. You speak French, Chinese, Patois, whatever. It's very important that you have to ask for those things to be available. And they're not always, like I mentioned, not all nurses are going to be bilingual. But doctors, talk to your physician. It's very important to talk to your physician because it will happen. Less expensive. It is less expensive. It has not to do with quality. Many people think quality has to do with price. Not really. Puerto Rico, since the 1960s, in terms of Medicare reimbursement rates, we have the lowest reimbursement rate of the United States of America, even less than the United States Virgin Islands. And we're talking about something's 50% less, others 27% less. And what happens when you have insurance companies saying, well, if Medicare pays you $10,000, well, then I'll pay you $12,000, but I'm not going to pay you $40,000 like in Florida. So what has happened since the 1960s, insurance companies are paying less. Equipment's the same, the CyberKnife technology, the company Accurate's going to tell me, I'll give you for a cheaper price because you get lowest reimbursement. It's the same type of pricing in the medications also. So what they do, how hospitals make money? Volume. They make money on volume. And in terms of also pricing, for example, but then also insurance is going to be less, the premiums are going to be less higher, but the quality, the accreditations have to be the same. So that's why pricing in Puerto Rico, and now you're going to see, that's why you have the medical tourism boom. In our facility, you have people that are coming all the way from Wisconsin, California, to do knee replacements, hysterectomies, things that are elective surgery in Puerto Rico, because they waive their deductibles, their self-insured companies are waiving their deductibles and things like that, because it's less expensive. I'll give you a sample. A knee replacement in Puerto Rico, it will cost like $12,500, everything included. The implant is a Medtronic, Johnson & Johnson. The doctor will be a Henry Ford resident, that did orthopedic surgery with a fellowship in joint replacement, and everything will be in a joint commissioned facility, but it won't be $40,000 to $50,000 like it's in the States, because prices here are not inflated, and that's part of the way it works. Concept of hospital-centered care. I know in the States that has happened over 30 years now, but now it's starting in Puerto Rico in the past 10 years. So you have, for example, now you have a robotic surgery center. You have, which is the Da Vinci. For example, Dr. Lerano, he opens that surgery with the robotic at Da Vinci. You have epilepsy centers, cardiac centers. So it's very important that you know which ones have not only the special accreditation, but also the awards. There's a lot of hospitals that have key quality awards given because of their quality outcomes. And you can look at the websites of those awards of the American Heart Association, American Stroke Association, and look what they have. Not all of them are going to have it, but most of them are. Just to let you know, here in Puerto Rico, you have 3 levels of care. Primary, secondary, and tertiary, like in the States. The primary, basic lab, basic radiology. But when you get to tertiary, you're going to have those big centers of excellence with 400 beds, 500 bed hospitals, ICUs, neonatal ICUs, and things like that. So what you have to think about is, of course, if I go to a smaller facility and I'm having a heart attack, it's not going to have a cath lab. So the issue is they're going to transfer you then to another facility that will have that. So that happens too. When here you have laws, like the EMTALA law, the HIPAA law, the same laws as in the States. But when you go to a facility, they'll accept you, they'll stabilize you. But if they don't have a service, then they will transfer you to a bigger facility. Nurse practitioners. Here in Puerto Rico, we do not have nurse practitioners. Physician assistants. There's no physician assistants in Puerto Rico either. So when you speak to your surgeon and says, oh, we're going to do a surgery, and I'm going to have an assistant, it's another surgeon. It's not going to be a PA. The only place PAs can practice is in the Veterans Hospital because that goes under federal law. Also, nurse practitioners can work at the VA. Other differences, now you're going to start having international centers. And this is where you should go. I know you live here in Puerto Rico. I started an international center at Grupo Ima San Pablo, one of the largest healthcare systems in Puerto Rico. And why we started these international centers, now we're bringing people not only from the US because of medical tourism, but you have all the Eastern Caribbean, which most of them come from British Islands, that only speak English, to these hospitals. And they want fully bilingual staff, fully bilingual care, someone picking up at the airport. We do their airline tickets, hotel discount rates for the Caribe Hilton, El Conquistador, all those things. But they want it on a very concierge basis. So an international center is a concierge service. So pretty much what I recommend, and Giselle's going to give you all the list of everything, go to the international center. It says, well, I just moved to Puerto Rico. I need an emergency. If it's not an emergency, I just need an appointment. Can you help me? The staff there is going to be bilingual, and they do kind of a shadow system. Yeah.
What do you mean by the international center?
Well, now hospitals are having an international center for patients that are not from Puerto Rico, and most of them are only English-speaking islands.
So each hospital has?
Not all of them, but most of them. The big ones, yes, like IMA, Auxilio Mutuo, San Jorge, Ashford Presbyterian is also opening one. Some of them are small international centers, like it's an office. You can say an international office. Let's do that. So they have 1 or 2 people. My department has over 25 people in it, and they have everything from a 24/7 call center all the way to hostesses. And that host will literally take you by the hand and take you to the pre-admission or the lab or wherever you have to go. So ask for that. Ask for that international center. It will be easier for you because many of them, and for example, in the international center that I founded, not only we do it for patients that are not from Puerto Rico, but even from islands that are part of Puerto Rico, like Culebra. There's a lot of Americans that live in Culebra. So what they do is they call, we pick them up at the ferry, and take them to our facilities. We have many different facilities around the northern and northeast part of Puerto Rico, and take them where they have to go, and yeah.
But we wouldn't be excluded if we lived here for a couple of years.
No. They help tourists, cruise ship patients that are walking on San Juan and they break a hip, and things like that. But it's the truth, and this didn't exist before. I'm telling you, most of them created the international departments last year. We created ours in 2008, but it's something that more and more is the only way to bring patients from outside of Puerto Rico to have that one-on-one patient care and that seamless, very easy process. Same thing with wellness programs. Now hospitals are starting to have that. It's a full executive checkup. Like if you go to Cleveland Clinic or Cooper Clinic, which has very good checkups, same thing. One day you do your full checkup and you just leave. And you see the internist, he tells you, hey, you have to lower your cholesterol, you have a nutritionist, gives you a special diet, anything like that. So these are things that, look for them online. Ask us if you have any questions on which facilities. I know Giselle's going to give you a full list of everything. So then let's go to emergencies. I know that's the... Oh, yes, of course. Yes.
Good question. In the U.S., the concept of concierge services is where you pay a certain amount of money to have that provided for you by a physician with a reduced number of patients. But how does it work financially here under the title of concierge?
Well, when you enter the concierge, that's free of charge. I don't know if other hospitals do, charge it, but at least where I work in, and I know of 2 more, do not charge that. They give that concierge. If you say I want to go to your facility, then they will include it. And I have insurance, they're going to be private pay, they will include that because it's an added value for patients that cannot get around the system because they do not know the system or they don't speak the language. So automatically, like I mentioned, it could be a tourist, it could be, someone from a neighboring island. Even, I have, for example, in our group, a guy, he's a guy that is from Denmark, that's married to a Puerto Rican and lives in Caguas. And he's been here 20 years, and he's in the program. And I know he understands a little bit of Spanish, but you know, he says, no, I don't speak Spanish, so he could be in the pro, but it could be, no, but we understand, he's not used to even, the system, and even though he's been here 20 years, you know, so it's not, they don't know, they don't charge extra, like I mentioned there, I know of 3 or 4 that don't charge, others, we have to find out, but normally, at least in our system, no. Same thing, so emergency rooms. EMTALA, that's the Emergency Treatment Active Labor Act. So when you enter a hospital, they have to see you, like in the States. If they don't have the service, they will stabilize you and transfer you to another facility. The same if, let's say, they don't accept your insurance or anything, something will be worked out in terms of, you know, private pay or reimbursement or what the process has to do, but they have to attend you by law. Same thing with HIPAA. Remember, there's HIPAA law here, so it's not that a family member can call the hospital and say, oh, how's my mom? You have to permit, you have to give a consent. The same thing with consent forms, DNRs, exactly as in the States. There are certain laws on kids that are very different. For example, here, the legal age, you're still a pediatrician, and you're still in pediatrics till you're 21. So if I'm 18, and I want to get a surgery, without the signature of mom and dad, I cannot get surgery. So it's very important that you know when you have a kid, yeah.
So that means if you have a 19-year-old and you take them to the doctor, as a parent, I can still get the information without having.
Yes, by law you have, yes,
Okay.
yes. And also, if she has to get surgery, it has to be signed by you and also the father. If the father or the mother is not available, then you have to have, you can have any type of, what they call, you know, affidavit with saying, you know, the father approves of the surgery or the mother approves of the surgery. But here, normally, both of them have to sign. And they will go, she will go to the pediatric unit, even at 19 years old, yeah. Unless it's like a very special condition where she has to go maybe, well, I hope not, but a burn center or, you know, any other area. The same thing, pediatric versus adult. When you go to an emergency room, you have pediatric emergency room, adult emergency room. Not all hospitals have it divided, but most of them do, especially big tertiary centers. Focus of the hospital is very important. Okay, if you're having a heart attack, and maybe you go to your closest hospital, if it doesn't have a cardiac center, remember, you're going to be transferred, but that's time being lost. Remember, time is brain, time is heart, especially I'm talking about stroke and heart attacks and things like that. So, and this happened the other day to my uncle. He went to a small facility, and then of course, even though they gave him everything to stop the heart attack, he was transferred to another facility where they did the door to balloon, where he came in, which is by the American Heart Association, and then they took him to the cath lab. But he lost around 30 minutes between all of that. So try to go to the nearest cardiac center. Stroke, the same thing, to the nearest stroke center. Yes?
But in a case like that, isn't it better to at least start getting some type of treatment on board, depending on where you're on the island?
Yes, yes. And that way, that's why it's better to call the ambulances. Because the ambulance will start doing that.
But for stroke and cardiac emergencies, you have golden hours. So
okay,
yes.
so
you need an amount of 6 hours,
yes.
for example, to diagnose a patient with an ischemic stroke and give them thrombolytics, which is what's given. You have 6 hours. So patient needs to get to the stroke center within 6 hours. Same as in the U.S. It happens in the U.S. also.
All the time. Yeah.
All the time. Our geographical area is not bigger than, you know, what it would take for you to go from like a community hospital in the middle of Alabama to a big medical center to get what you need for appropriately handling a stroke. So.
And as far as like ambulance services, I mean, the CHO is here.
That's what we're going to talk about next. Yes, exactly.
Sorry to interrupt.
Yeah,
Just so you know, you're all hearing about these particular trauma centers or these ambulance services. We're going to provide a list of all of these places for you, and we're going to send them to you.
Yes.
So you have a list.
We want to make what she wants to do is to build a resource. So it's not a talk. It's more like a conglomerate of information that we're going to give you.
No, this is great. I'm glad that you posted it up. So we're happy to be here.
Great. So I'm sorry.
Yes, no,
this
no.
is a stupid question.
No, no.
Does 911 work here? I mean,
Yes, it does. It does work, but you have to know many times when you call 911, they're going to take you to the closest facility or to Centro Médico.
It's by law.
And by law.
By law.
By
You have
law.
to take it up. So you might end up in Sede de Dorado, which you don't, or you don't want to be for. I don't want to say don't, but
There's places you don't want.
Yeah, exactly. You want to avoid. Same. It happens everywhere. You know, it happens in the U.S. too. You end up somewhere where you don't want to be. You know.
Because a Senate days, a center of diagnostic treatment. The only thing you're gonna have then is a lab and an X-ray. That's it.
Yeah.
And even though they do the best lab and maybe the best X-ray, that's their limitation. So it's go that you go directly.
So you need to know that we give you information on big facilities where you want to be, and you know, but there are places like everywhere in the world where you want to avoid. You know, if you're in Paris and you end up in the wrong hospital in Paris, you're in the wrong hospital in Paris. So it's the same thing here. You know, if you're in I don't know, Dorado or out west somewhere in Lincoln, you end up in the wrong hospital close to there, then you're in the wrong hospital. That way, it holds the rule holds the same everywhere. You know, everywhere you go. So,
but I'll tell you about the ambulances and how it works. But in terms of other services, you know, all hospitals, you know, you break a leg or something, that pretty much they're gonna have it in most hospitals, and they take you. But you know, what I'm telling you, like stroke and heart, you have a time period, and for example, with heart attack now, you hear less and less that people are dying, but there's damage. There's damage to the wall of the heart. Yeah.
So if I heard you correctly, if you call 911 and you know you want to go to a stroke center, or you know you're having an MI, and you know there's not a CT at the hospital, we're going to take you to rule out, you know, a hemorrhagic stroke, and you tell them, oh, I want to go to Ashford or something, and but by law they may tell you we can't take you there. So you might be better just getting in the car and getting your family there.
Yes.
with public ambulances.
But there's private.
Well, there's private ambulance. That's how they always gonna get called, a private ambulance. You know, have one in your refrigerator. Have one number in your refrigerator, and they will call right away, and you can tell them. Or in this case, not only with stroke or MI, my primary care physician is in this hospital. I want to go there. Okay. So with private ambulances, you can do that. So have a number of your private ambulance. 911 is good, for example, when you don't know what to do, call 911. I'm not saying they're bad, it's just they're going to take you by law to the closest facility or to Centro Médico. Trauma, though, is a different story. Burn, there's burn that will take you also to the closest if it's a small burn or something. If it's a big burn, or they will take you to Centro Médico or a private burn facility, like where EMA has a full American Burn Association burn center. But if it's a car accident, even anything that happens in a car, automatically you're going to be taken to Centro Médico. Private, you cannot go to a private facility even if you want to. So that's then because ACA applies there, which is the car accident medical insurance. So when you have a car accident, you will go to the trauma center directly, which is really good. It's where the University of Puerto Rico, then you know it's a public hospital, so it's going to be very full. But you have interns, residents, everything, and it's top notch. But it's not, it's not pretty. It's not a fancy hospital where you can have a nice lobby and all these things. No, okay, it's a trauma center.
We'll talk about
yeah.
it.
Okay.
Question, Grace.
Yes.
So when you go to this particular car accident trauma center, they don't take any other, they don't take insurance, right? Private insurance.
No.
But it's covered by the insurance that comes with your car. When you buy a car here, right? That auto insurance?
Not really. It's just an automatic insurance for anyone that has a car accident in Puerto Rico.
Yeah.
Doesn't matter if you're...
No one's paying for that
No,
automatic
no
car
one
insurance.
paying for it. It's part of the government. Yes, not from... Like I know in the States, it's part of your car insurance. No. Here it's just... it's like anyone that has a car accident, doesn't matter, even if they're not from Puerto Rico, it's under ACA, automatically. ACA pays for that. It's a very peculiar...
That only covers medical, though.
Medical, yes. If it's, of course, your damage of your car, that goes with your car insurance. Yeah, that goes with your car insurance. But the medical part is through ACA. Okay?
So you're not going to get a separate bill for radiology?
No,
surgery,
nothing like that.
surgery,
No.
everything?
No.
Yes.
Yes.
The ambulance, you call your 911, the ambulance comes and they pick you up and then they won't charge the...
No, they won't charge. No, they won't. Everything will be automatically going there. Okay? And even when it's a car accident, it has to be there 911. Even if you call a private ambulance, they will have to take you to Centro Médico, but it will be 911. Yes?
Is there less litigation here around car accidents because everything's so well covered by the government?
What, like there's less litigation here?
Yeah, between drivers, if there are disputes.
There is not that much.
No, there's not that many,
There's not that much
honestly, yeah.
litigation here
Yeah,
regarding
in
car
terms of-
accidents. I don't think,
Yeah.
that's not an issue in Puerto Rico.
Okay.
That, you know, discussed because it doesn't
Like, you
happen.
don't see someone paying someone else's medical bills in
Yeah, yeah.
in that, honestly, I haven't never, you can, yes, for example, like, I can tell you of cases where later on, let's say you were with someone died, and maybe the family sued the driver, but that's different, that's a different story. But it's not about, that's because of more emotional loss or things like, but not on like, oh, you have to pay my medical bills because, that normally is not fine, because ACA will cover it. Workplace emergencies. Not only you, but if you have employees, if they have an accident, they have to go to El Fondo, which is the industrial, it's the workers' compensation hospital, and that's where workers' compensation applies. They have a website, you saw apply to it. It's very good that you know the laws, because if you have a local employee that falls, he can sue, like in the States. So look for the laws that go specifically into workers' compensation, and because it can not only be a fall, but it could be my secretary, she's 14 hours sitting on a chair and her back is screwed.
Make sure you're compliant
Yeah,
with
you're
the
compliant,
insurance
yes.
laws regarding workers' compensation in Puerto Rico, because that's a debating point, because it happens. So,
Yes.
so that's important to know that.
Yeah, you don't want to get a lawsuit from an employee saying, I have carpal tunnel or something, because they're very different in some ways to the States. Ambulances. Okay, if you call 911, you're going to end up at the closest facility or Centro Médico, like what we mentioned. If you put a private ground ambulance, it will probably arrive faster, and then we'll take you where the private doctor is located. So it's very important that have a number of a private ambulance, and also call if you have that the phone number of your primary care physician, say your cardiologist or nephrologist, if you're in dialysis or anything. Call them before. Yeah, I don't feel well. I have to go. He will tell you where he's at too, because maybe he works in 2 or 3 facilities. So he will tell you, go to Auxilio Mutuo or go to HEMA. I'll be there waiting for you. Or I'm not here, but my partner is there and he will help you. So it's very important to call your physician before. That way it will be more of a pass-through. And if not, when you enter the emergency room, if not, they have to go through the whole thing, and like all emergency rooms, you have to wait and things like that. If you have conditions, that's a good thing about going to centers, big centers. Like if you have a stroke, that's literally a super fast, immediately going through, because they have to follow protocols because they are a primary stroke center. The same thing if they have, now you have hospitals, small hospitals, because they cannot maybe get a vascular neurologist to be part of the stroke center. They're doing telestroke. So for example, we have in our system, we have 2 small hospitals, one is 66 beds, the other is like 180 beds, and even other 4 hospitals in Puerto Rico. What they're doing is, literally the patient comes in with a stroke, they have a telecart, they send the images through PACS, which is a radiology system. The vascular neurologist, he could be in his house, but he's seeing you, asking you, going, do certain things, seeing seeing the images, looking at your labs, etc., and say, okay, put the TPA. So in a way, you are in a stroke center, even though the vascular neurologist is sitting at his home at 2 a.m., but he's physically there. So also look for centers that are in affiliation with a stroke center, because they'll probably have a telestroke, okay? Because you only have, remember, 4 to 6 hours to get the TPA. Air ambulance. Let's say you had an emergency, end up in a hospital here, but you want to go back home. Okay, it's very important to be transferred. So now you say, oh, I want to be transferred right away, and that's it. Talk to your physician and says, I want to go back home. I want to go back to New York. I've been treated there for 20 years. So in this case, what they're going to do is a nurse case management will go to you and start coordinating the transfer. So it will be a bed to bed. So if you're hospitalized here, they have to go through a bed here, ICU. But your hospital over there has to accept you. You cannot just be transferred to the air. So, no, because it sounds, you know, for many of you weird, but a lot of people, when says, oh no, I just want to go back home, but you have to understand there's a protocol. We had once a patient that in his case was going to a skilled nursing facility. It wasn't that, you know, he liked the family liked the service, but he could have to continue rehab. It's going to be over 3 months and things like that. Many facilities in the States weren't accepting the case, even though they wanted to go. So it's very important that you know, even though we are willing and we want to, the hospital says has to accept you. And the same thing with the skilled nursing facility, rehabilitation center. Many of the physicians here have to know where afterwards you're going to go. If you have a surgery, it says, okay, I'll get the surgery here, but I'll do the rehab back home because it's going to be a long time. Then he has to know where you're going back. It's, you know, it's his license. This is a, you know, U.S. standards. Joint Commission can come in and literally, or Medicare. If I don't transfer from bed to bed, Medicare can put a huge fine in our hospital. So it's, you have to, you know, it's very similar as in the States in those sense. There's a lot of air ambulance companies. Giselle will give you a list. And the same thing, you know, I recommend if you want to use an air ambulance, use one that's based here. Will be less costly and it will be faster. If you use one that's coming from the States, of course, you have to pay way here, way back, and it will take a longer period of time. Yeah.
Helicopter service if you're, like, say, on PAKs or you're
Yeah.
out of ways and you want to come. How is that through 911 or is that private?
Well, you have both. You have private and you can do it through 911. But if you do 911 though, and you call from Vieques, maybe they're just going to take you to the Vieques hospital. So in that part,
They take you to the Centro Médico.
or then, yeah.
If you
so
go
the
from
next
Vieques, they're going to take
Yeah.
you to the 911 call. It goes through the Aeromed system, and that goes directly to the trauma center in Centro
There you
Médico.
go.
They'll fly you there directly.
Yeah.
Which is obviously the
Which is the only trauma center in Puerto Rico, which is the Centro Médico, which is the University of Puerto Rico Hospital Center. So, but let's say you just want to be transferred out, it's not a huge emergency. Yeah, find also there's companies that do airlifting, and you can also even go to private hospitals. Some of them, I can tell you, IMA San Pablo Gawas has a helipad in the back. We get patients all the time from like the BBI and the USBI, and instead of going to the airport, the helicopter goes to the helipad in the back, or there's a baseball field close by, they can land over there.
Do you, let's say you're an hour outside the city and you want that for a heart attack or stroke, can you just ask for it and they'll do it, or?
Well, if you do it and you pay, yes.
But is that through 911 or that's through the private?
It has to be through the private. Yeah,
Okay.
911's not gonna, yeah.
They won't do it,
Yeah.
okay.
So for the private ground ambulance, if you insurance cover it, how do you have to have cash on hand at the time or something?
Yeah,
They
it
bill you,
will
or-
be like $100, $125 or something like that.
That's it?
Yeah, that's it, yeah.
Wow.
Yeah, just keep going on real close by.
If that's all it is, I mean, that's.
Yeah.
Taxes.
There's thousands of companies of ground ambulance. When, you know, and most of the, and even you can use something reimbursed through your plan. Normally what they do is, you just pay cash, just give me a receipt,
No, I
and you
mean,
just
you just say that it'd be like $500 to $800
No,
or
no.
something like that. I mean, that's just, you know.
If that happens, so you call me, because then I will literally call them and insult them. No.
Okay.
No, it will be, you know, from 100 to 200 maximum if it's like a big critical care. No.
Now, are there rates published, or can you ask them?
Yeah, ask them before, ask them how much is it, so I can have the money prepared, that's it. And they will tell you right away.
They don't take credit cards.
Some of them do, Yeah, you just have to ask first, always, ask first. Medicare, like veterans, things like that, those are by law, they have to be covered, okay?
What do you mean by that?
Because, for example, when you have, in terms of Medicare, not only ground ambulance, even if it's also that, if you have to be transferred to another facility, they're not going to pay, you don't have to pay for that ambulance. So, even if you have private insurance. But in terms of Medicare, Medicare covers everything in terms of transfers, even ambulatory care when they have to transport you back and forth. So in those things by law, Medicare covers for Medicare recipients, of course. $60.
But it's only through 911, not through the private.
No, private insurance too, Medicare, yes, Medicare. Just tell them I have Medicare, and that's it, okay? In terms of private insurance, like I mentioned, it could be private pay. Some of them do accept insurance. I know a lot of ambulance companies that do. Just tell them before, I have this insurance. They'll say, no, it's cash, then we'll go. Yes, of course.
How about air and how does this come?
Well, air ambulance, I'll tell you a little bit rough on, in my department, we work a lot with air ambulance. Let's say a transfer from here to Miami, it will be around $20,000. That's an air ambulance. If it's from here to St. Thomas, it's about $5,000, $6,000. From here to New York, it will be around $30,000 to $40,000. So air ambulances are really expensive, and it all depends also on the type of care. If it's a neonatal and a NICU baby, that's the most expensive one of the ranges, but you know, it depends. If it's just a patient that's bedridden and has to be taken for rehab, it will be less. But normally, it's air ambulance, you know, the pricing is a lot higher. But you know, some insurances do cover air ambulance, so that's something you should also check with your insurance company. Do that, or you can buy. I recommend MASA. MASA is an air ambulance insurance, and they have 3 different types of packages. One which is like local, when I mean local is like regional. One which is like access to the closest U.S. facility, and there's the third one which is full access. So MASA is an air ambulance insurance, and I do recommend it, and it's worldwide. So even if you're not living here anymore and you go somewhere else, which I hope not, then you know, you can continue with your MASA insurance.